Folks, in today's edition of Men's Health, we're going to be going below the belt buckle. We're going to be talking about testicular cancer and colorectal cancer. You know why? It's not being talked about enough, and it should be.
Traditionally, colorectal cancer is a disease that affects elderly people, or at least increases risk with age over 50 to 55. Over the last couple of decades, what's happened has been in the older group, the rates of colorectal cancer have declined. In the younger group, less than 50, the overall rates of colorectal cancer have gone up.
Since those under 50 aren't typically screened for colorectal cancer, they have to pay close attention to any stomach troubles.
Anything from abdominal pain, bloating, increased straining with bowel movements, blood in the stool, anything like that. It really has to be checked out by either your primary doctor or a gastrointestinal specialist.
And when Trey Mancini was diagnosed at 27, it brought a lot of attention to the disease itself. And knowing your family history, his father had been diagnosed at the age of 58.
Family history is one of the strongest predictors of risk. So because of that, anybody with a family history of colon cancer is at an increased risk themselves of having the colon cancer. Studies have shown that there are increased rates in Black and African American communities. The reason for this, one idea that's been thrown out there is that there are some, unfortunately, healthcare disparities in messaging to African American communities and also in the prevalence of screening in general. So that's something that, as a healthcare profession, we have to improve that. We have to take care of our communities.
Now, if you catch it early, colon cancer is treatable, therefore it is beatable. Now let's talk about testicular cancer.
The main age ranges for testicular cancer is between the age of 15 and 34. So it clearly affects young men mostly. It is hard to appeal to young men who aren't necessarily serious about anything potentially at that age to engage in a self-detection sort of mode and be serious about their body and be serious about their health.
And there are three main symptoms to look out for.
It's usually discomfort, swelling in the area, or a palpable mass, meaning that they can feel a lump or a mass in the testicle. It is highly, highly curable, however, and the testicle removal itself may be the only thing that patient ever requires for complete cure. God was good to us, and in that He gave us two testicles and many organs in our body. We have pairs of them, and usually with just one functioning testicle, men are very much still can be fertile and can very much still produce enough testosterone to have masculine features.